Now we're going to talk about a bunch of acronyms when it comes to Medicare, OEP and the GEP and the IEP and the SEP and the AEP, and it's just all so confusing. So a lot of people, unfortunately, are not getting the deadlines that they need to enroll or disenroll or change plans or whatever the case may be. So I have brought Mr. Medicare here, Ari. And with Chapter Medicare, he's helped, him and his team have helped a lot of people that watch my channel with all things Medicare. So I've invited him here to untangle all of the deadlines to make sure you get protected, you don't get charged extra, you don't lose your health care for a few months or years or whatever the case may be. So how you doing, Ari?
I'm doing great, Dr. Ed. So excited to talk Medicare with you.
And I understand you have some you have a little show and tell as well, huh?
I do. I have my Chicago Bears Medicare jersey.
The Bears.
I get made fun of when I go to the grocery store on Sundays wearing it.
All right. Are they
Because,
tapping on your shoulder and says, can I talk about Medicare?
yeah, number 65.
Oh, okay. Who was 65?
It's a good question. I get made fun of by fans who are fans of rival teams because they say it should say 85 since that was the last time the Bears won the Super Bowl.
Yes, yeah, the refrigerator and all the rest of them, right? Yes,
Yeah.
Yep.
William
I remember
Barrett,
that.
great.
Yeah. All right. Their help is 100% free, and y'all help people throughout the country, right?
Nationwide, all 50
Nationwide.
states and the District of Columbia.
Okay. All right. And all right. So let's get in. Okay. So probably since it's still March, the Ides of March, actually. Beware the Ides of March, right? Well, Julius Caesar,
Beware.
Shakespeare there. So we've got two big deadlines coming up. So one is kind of a Social Security deadline, and the other one is a Medicare, not A and B type of deadline. So I'll tackle the Social Security deadline.
Sure.
In terms of the GEP, the General Enrollment Period. So that's the one you have to go to the Social Security Administration. Unfortunately, Chapter really can't. They can, give you some direction, but you actually have to go to the Social Security Administration. And unfortunately, nowadays, kind of good luck with that because Social Security has lost a lot of employees, and it's very, very difficult to get assistance. So if you're gonna try to get into this general enrollment period, you better do it quick because the days are marching by. So basically, what it is, if you forgot or didn't or failed or you left the country and you came back or something like that and you need to sign up for Medicare Part A, Part B, or just Part B alone, whatever the case may be, then this is the time to do it. January, February, and March. You have to do it by March 31st. And yes, you just might get a penalty. It's a 10% penalty for every 12 months you did not have Medicare when you were supposed to. So if you left the country for 5 years or whatever the case may be, and you come back at 70 years old, and if you didn't sign up for Medicare when you were supposed to, I'll talk about what you're supposed to. If you didn't do it when you were supposed to, then you've got a 50% penalty. And 50% of what? 50% of the $185. You have to pay $185 plus 50% of that. And there's also a penalty for Part D, the prescription drug plan. But you have to sign up for that by the end of March 31st. And the law changed about a year and a half ago now. It used to be if you signed up during the general enrollment period, whether it was January, February, March, it didn't matter. Your Medicare Part A, Part B, whatever, would start July 1st. But luckily, Congress decided that's not great. So they changed it. So if you sign up January, your Medicare starts February 1st. If you sign up March, your Medicare will start April 1st. Okay. But if you have health insurance from work, if you were supposed to sign up at 65 or you were you were eligible to receive Medicare because you were on disability for 2 years and you didn't sign up, if you had health insurance from work, current work, yours or your spouse's, and that employer, that group health plan had 20 or more employees, then you're good. You don't get penalized at all. So you can sign up pretty much anytime. You have 8 months Once you lose that health insurance from current work, we're not talking COBRA, we're not talking a retirement plan, we're not talking about the Affordable Care Act, from current work, yours or your spouse's. So if you lose your health insurance, you're about to lose it, you technically have 8 months to sign up for Medicare to avoid the penalty. Technically 8 months, but you know what happens if you don't have health insurance for 8 months, right? That's usually when you actually get sick or somebody, steps on your toes or whatever the case may be. So it's always good if you know you're going to be losing your health insurance, then reach out to Social Security. If we'll talk about the special enrollment period here in a little bit, but reach out to Social Security and get your Medicare started, and that way your health insurance stops from work one day and at the end of the month, and the next day, the first of the month, your Medicare Part A and Part B and all that stuff. And then you can call Chapter and they can help you with all the rest of it. Okay. So I think I covered GEP, and do it as quickly as possible, because, you may think that, with all the offices, being understaffed, it's been understaffed for a long time, but it's even worse now. You may think your local office, you drive by your local office and you think it's open. There might be people in there, but Social Security offices are broken up into different programs. So the people that might need to help you with retirement or Medicare or Social Security disability, they might have quit, or be, as we used to say in the Marine Corps, voluntold to leave. So the only people in the office only handle like SSI, this is the welfare-based benefits, supplemental security income, or vice versa. So nowadays it's good to do it as soon as possible. Okay, there's that. So Ari, do you want to tell us about the OEP?
Yes. I just want to lay a little bit of groundwork for your audience, though, because you're mentioning the general enrollment period. So there's 3 bite-sized decisions that your audience should be thinking about. The first is, how do I start Medicare? And so what Dr. Ed is saying is, if you missed your initial enrollment period by way of turning 65, and you missed your special enrollment period if you're past age 65 and coming off work-provided coverage, then you would use the general enrollment period to start your Medicare. And that period ends March 31st. Right now, we're also in the Medicare Advantage open enrollment period. This is for someone who's already started Medicare and is on a Medicare Advantage plan, and there's something suboptimal about it that they want to change. And what are the things that you might want to change about your Medicare Advantage plan? Well, you may have gone to the doctor last month or at the start of the year and discovered that one of your preferred providers isn't in network. That would be a good reason to reshop your plan and find one that has all your doctors covered, or the institutions that you would want to go to. Another reason that you may want to reshop your Medicare Advantage plan is if you discover that your prescription costs are too high, or you may have a prescription that isn't even covered. There's over 50 different Medicare Advantage plans in many different zip codes, and they vary across the United States depending on where you live. And so it's important to shop all your options and make sure that you're working with someone independent and unbiased who has all plan options available and is ready to discuss all of them with you. So you should ask that person, how often have you recommended a plan that doesn't pay you? You might be surprised by the answer. You should also ask, how many carriers do they represent? They might be captive to one insurance company, or the typical advisor is only appointed with 3 to 5 insurance companies. Make sure that you're working with someone who can evaluate all your options with you and has a way to programmatically search, based on your doctors, your drugs, and your priorities, which plan is the best fit for you.
All right, so that's OEP, and in terms of medicine.